Hey folks, John Matus again. Wanted to do another one of my little pandemic blogs, if you will. This one today on the leadership during the pandemic, both from the government and from various media figures. Before we do that, just a couple of quick words here on my system. If you've seen any of my videos, you kind of get this thing. But when I put stuff out there, if it has good evidence, you get 3 thumbs up. If there's some evidence, there are 2 thumbs up next to the blurb. If there is some sort of anecdotal evidence, there'll be 1 thumb up. And tinfoil hat crazy means somebody said something stupid. Just like no support, maybe flies in the face of like good solid evidence. I've been promising you some tinfoil hat ladies. I'm going to have some. I'm going to deliver this time. So I'm going to put a couple of those out here. If you've seen the cases, well, the numbers are getting grim. It's about 1.5 million people worldwide. You may notice that the deaths ticked up a little bit. I'm going to my little pointer here. This thing was hovering at 20%. It's today at 21. That's grossly inflated because, again, not capturing mild cases, and mild cases water down the death rate. So this is not a great figure, but it is a little higher than it was before, probably worth remarking about. Serious or critical is actually a little lower. This was hovering at about 5% the last time I did a video. Again, this is worldwide, totally reliant on the honesty and the accuracy of every nation's reporting system. And to be fair, many nations are just terrible at this. Just to give you a sense of the thing, here are the figures for each country. You will notice again the USA, almost 500,000 cases now. Lots of testing going on right now. I shouldn't say lots, that's maybe a little bit of a misnomer. It's still pretty hard to get tested in the United States, like surprisingly so. And whereas some facilities are getting results back in a couple of hours, with some newer testing, some of them are still promising results over 5 or 6 days. I'm doing a bunch of COVID follow-ups now as a project for a customer, and I'm calling their observation and positive confirmation cases, and these folks are still telling me like several days. I had a guy today on his like 8th day of waiting for a test. So testing is not as good as sometimes we would like it to be or lead it to believe. Spain, as you can see, still in position number 2 here. Fatality rate disturbingly high. Oh, sorry, that's the wrong one. Fatality rate disturbingly high. In fact, highest amongst all nations. Italy coming in as a close second. These again are the 2 hotspots in Europe. France coming in a third. You can see that France's numbers are rising exponentially. I mean, disturbing stuff coming out of France. Deaths per 1 million population in Germany still abnormally low. We're all sort of looking at this, scratching our heads, because nobody is really 100% sure why that is. They did a reasonable job in just managing. In fact, they had one of the earliest European cases, but then their growth was somewhat slow, and not everybody fully understands why. But there's some interesting data coming out of there, which again warrants evaluation. China, just, yeah, +2 cases. It's almost comical in a country of 1.5 billion people. It's hard to imagine that that's even remotely close to true. There are some other nations, like I said, putting up some pretty serious numbers and warrant looking at. Brazil, again, in a South American country, highest on the list to my knowledge. Yeah, for South America. So we'll look at this as we kind of go through. Again, they get a little numbing at some point, like the numbers, because they're so high. In the beginning, in mid-January, when I was tracking this, seeing, a few hundred cases increase was just amazing. And now, the numbers that we're putting up here, especially in the US, have 5 digits on them for new cases, and we haven't even supposedly peaked yet. So disturbing, like I said before. This is covid19.healthdata.org. It's a website that I introduced into my last video. This is actually incredibly interesting stuff. I tend to be a little locally focused, so I drill down on New Jersey. But you can see healthcare resources and the anticipated volume demand, and you can see where your bed surplus or shortage is. I say surplus because I think Alaska has more beds than they think they're going to need. Maybe it's just not very dense over there, or for whatever reason they have lots of healthcare resources and we don't. But as compared to their population, they're doing okay for beds and expectations. We're also dreadfully short on vents, so when this thing peaks, it may be pretty difficult to deal with. 6 days again until the projected peak. So today being the 8th, that would be around the 14th. So again, significant, and that's a little different than peak resource use. Um, I suspect because fatalities tend to come after peak resource use. So, and again, if your resources run out, it makes sense that your deaths would increase after that. So, they kind of have this modeled out in a really interesting way, and you can see graphs if you like them, and you can just sort of focus in on beds or ventilators or ICU beds. So, incredibly interesting if you want to go have a look. Okay, so I worked a shift a couple of nights ago. It was an overnight. So from my perspective, I'll just kind of share with you. Again, healthcare facilities, long-term care, still, you know, total lockdown. The 911 calls that I took were just sort of all over the place. We were way out of our service area. And what that usually means is we're answering calls into other people's territories because they're backed up. So I think I had I don't know, probably 6 or 7 COVID jobs right in the beginning of my shift, in the first half roughly of the shift, and it was all COVID. It was like no other calls. It was all respiratory distress, suspected COVID. Got to say, the BLS guys doing a pretty good job. I mean, they're just taking a hammering for us. Most of these patients have relatively mild illness, at least from the perspective of EMS, right? So I'm releasing them to BLS, and they're going to have to ride that patient in and take the bulk of the exposure. But most of them pretty reasonable, being pretty smart about it. One guy suits up, checks it out. They try to get the patient to walk out of the house, which again is incredibly important for reducing like your inoculum, right? Because the patient's been breathing in there and hacking and coughing and depositing respiratory moisture all over the place. So smart stuff. I did see some Tyvek for the first time. 2 agencies wearing Tyvek. That's a reasonable move. It really is. I mean, I know that a lot of people are not into it, but honestly, if I have to go into someone's house knowing that they've deposited respiratory moisture all over the house, it's really easy to just brush up and get stuff all over you and all over your uniform. So I think that's completely appropriate and reasonable. Most folks are reusing their Tyvek, meaning they're spraying it down and taking another pair next shift, and when that thing dries, the next guy takes it. And given the availability of resources, I don't think anybody has the kind of Tyvek where they can just take it off and throw it out after every job at this point. So, you deal with what you have, I guess. Okay, so again, a couple of little things. I had 5 COVIDs right in the beginning of the shift. Like I said before, probably like a total of 6 or 7. We had another local die. That's kind of a shame. It was EMT. Worked for a local health system. I did not know this person, but again, it made the social media locally. And of course, it's just tragic and a shame that frontline people are dying like that. Again, reasonably young too, not somebody who had apparent. I mean, again, I didn't know him, but he didn't appear to have lots of comorbidities. He seemed like a reasonably healthy dude. Another physician locally died, and a nurse that I happen to know, tragic case, ER nurse, pretty beloved. So again, there's that toll, right? There's that human toll, and it becomes so much more real, right, when it's somebody that you know or somebody that you've met or worked with or something along those lines. A bunch of EMS folks that I know are positive. Um, Talked a little bit about this last time. Local medic, in fact, from my service, returned to duty today. Um, Good for her, beating this thing and coming back to work. But you're starting to see again lots and lots of provider effect now, and friends who manage nursing departments are telling me they're like 30 to 40% down on staff because they're all out COVID positive. This thing is really grinding through people, meaning resources and human resources. An additional BLS service suspended operations, another local agency that stopped responding to calls because of COVID-19. And a couple of commercial providers stepping into the void. And, there are good operations of every type. I'm not one to trash on any one type, whether they're hospital based or fire service or volunteer or just, commercial ambulance company. But locally, these guys are, stepping in when there's nobody else. So There's one service locally I've seen on a bunch of jobs, and they're just all over, man. Like whenever an agency doesn't have, or I'm sorry, a municipality doesn't have an ambulance, these guys are willing to go there and take the job. So, good for them. Um, okay, so I wanted to talk a little bit about leadership in this thing because this is probably the more tragic part of this whole pandemic. Listen, I'm not saying it's more tragic than the human cost. It's just information dissemination is really important, especially when you're relying on human behavior to limit a pandemic, right? So when you watch the news and you see crazy stuff being said and stuff that doesn't make any kind of sense, that does a lot of harm, and we can't quantify this. But when people hear bad advice and trust that source and then implement that bad advice, it literally will end up costing lives. And some of this is about government agencies. Some of this is about the media. And when you just trot out any guy with an MD to give public advice on things that they may or may not understand, and understand if this is a new model, like novel coronavirus, it's not necessarily something we have a lot of experience with, but that shouldn't entitle every guy who is, in contact with healthcare or generally in the healthcare field to render expert advice. I mean, there's just a lot of crazy stuff being said. And, before we move on, I just want to make clear I have no political interest in this thing. I mean, I have my own political opinions, but um, my little talks here have nothing to do with pursuing a political agenda. So, before you might think that I'm trying to politicize and manipulate disinformation for any political gain, um, I I don't care about the politics here. I think the virus is just far more of a better, juicier common enemy than the other party, whether I like them or not. So um, don't take this with any political context because there really is none here. So I wanted to show you just a couple of examples of leadership that is incredibly questionable. Um, First of all, the Center for Disease Control, like they are like the lead agency here, right? They're the people who we should be looking for solid advice. And I'm not saying they're nut jobs because they're not. They've got some brilliant people there. The problem is when they put out information, it's clear from like a healthcare administration type what they're trying to do. But the problem is the way they put it out there, they often end up essentially putting out bad information. And this is a really good example of that, right? In March, they're telling people you shouldn't wear face masks to prevent the spread of infectious illness. Face masks don't work. Only respirators work, and the public doesn't need those, and they don't know how to use them anyway, so they just shouldn't wear face masks. And the content, I mean, I even heard, and I don't know that I contribute this to the CDC, but I even heard, well, face masks are going to make you more likely to touch your face and get infected, or they're going to discourage social distancing. And that's just nonsense. I mean, we have decades of face mask use in China and in some other Asian countries. And by the way, the Asian countries that have done really well with this, like Taiwan and South Korea and Hong Kong, those areas of Asia have used face masks forever, and they're doing the best job containing this thing. They've been through SARS and MERS. They use them sometimes because of pollution. Like, this is a community where going out with a face mask is simply no big deal. Like, it's just assumed, like wearing a hat. So, the idea that face masks will not prevent the spread of infectious illness, that's just a blanket, absurd, false statement. I mean, you could say we don't have a lot of evidence to support it. That's probably true because I don't know if everybody's ever quantified it. But to actively discourage face masks by saying they don't work, that's not a responsible safe statement from a government agency. And what's super interesting here is it's not that they don't work. That wasn't probably what they were trying to say. What they were trying to say was we don't have enough for our healthcare workers, so please don't buy them on eBay or Amazon because we need that inventory for our frontline people. And you know what? Had they positioned it that way, and maybe this is my naive, like, wanting to believe in the American public, I think people would have probably been reasonable about it. Because if they're going to be at home and just occasionally go out to the supermarket, my hope is that they wouldn't just hoard these face masks that are needed elsewhere. I mean, I've seen a lot of like crappy behavior from people in this pandemic, but I've also seen a lot of really great behavior from people in this pandemic. A guy, we were driving the ambulance the other day, and an old guy walking down the street clapped at us out of the blue and gave us a thumbs up and a smile. Um, I don't know. I still have some like faith in the American public and their ability to kind of step up when the time calls for it. So had they said that, I think they would have been in a better position. And this is the proof. On the third, 5 days ago, the CDC had to walk that back. They had to say, well, maybe it's not such a bad idea. In fact, I love the way they spun this. Well, from recent studies, we found that a significant portion of individuals with coronavirus lack symptoms. That is not new information. The Chinese were screaming about that in January. Anybody with a YouTube account could have watched a video from the Chinese Health Ministry and known that this had asymptomatic spread. There are multiple publications on the internet where their health authorities warned the rest of the world about this being spread asymptomatically. This is not news. Okay? It's a convenient excuse for the CDC to walk this comment back. Because now, in light of this new evidence, it's just new data that apparently was hiding from only in YouTube, wearing cloth face mask coverings in public settings where other social distancing measures were difficult to maintain is now recommended. Yeah. But of course, a month ago, a little over a month ago, we just told people they don't work. Now we have to deprogram all of that. Not the right move. And the fellas at the freaking CDC, if you get that reference, by the way, kudos to you. They really could have positioned this a lot better from the start. And this, again, is where people start to doubt their institutions, right? Because if the CDC lies to you and then has to walk it back, you think they're a bunch of amateurs and you stop paying attention to what they say. So that's just a shame. Drew Pinsky. This guy's a complete freaking tool. He gets on the media on TV and is outraged by all of the media hype on this thing. Said the media was creating hysteria over coronavirus when this thing is less lethal than the flu. Now, if you don't know who Drew Pinsky is, he's like a talking head doctor who's been around forever. His claim to he's an internist. I think he also worked in addiction medicine. That's, I think, where his specialty lies. But this guy, what he's known for is something called Love Lines. It's a show that he did on the radio with a comedian where he would give like horny teenagers dating advice. It's really absurd that this man is like out there giving medical advice as basically a talking head physician. And he, like in March, by the way, where anyone following this would know, like anyone following this for the last like 30 days would know that this is a really serious public health risk. He gets on and tells people that the media is creating hysteria for no reason, and this thing is less lethal than the flu. That's time that people could have spent like preparing, buying some extra medicine for their prescriptions, buying some food, maybe like taking some precautions like stocking some water and clothing that they think they may need. Basically doing pandemic preparedness, doing all of those things that FEMA recommends and the Red Cross recommends on their website. But no, this guy, wanted to get on TV and, hype his public appearances. So he gets on and tells everybody, with a great deal of outrage, by the way, that the media is just hyping this thing. You know what that gets you, Dr. Drew? That gets you tinfoil hat lady, because you're a freaking tool. Absolutely ridiculous. I think he's since apologized, by the way. Maybe I'm being too hard on him, but that's just not good science, man. It really isn't. This guy. This is Mark Spiegel. He makes several like health contributions to, I think it's Tucker Carlson's show. So this guy's a physician. Does lots of medical stuff on Tucker Carlson's show. So whenever they need like a doc, they trot this guy out. So he was talking about traveling advice during the because of the coronavirus outbreak. And again, when you watch this piece, lots of outrage. Lots of like snarky commentary about how people do stupid stuff and you don't need this and you don't need that. So one of his bits was the face mask. Don't need a face mask, it doesn't protect you, it's lousy, it's terrible, it's a bad idea, blah blah blah. Basically just crapping on the average citizen who decided to wear one of these. Now, I get it. You're entitled to have your opinion. And by the way, he's kind of right about the protective part. It's not really, this thing, this surgical mask, not really very helpful for protecting you. But what it does, of course, is catch all the respiratory moisture you put out. So it protects people in general in the vicinity. So if everybody was wearing it, everybody would be protecting each other, right? Less respiratory moisture in the air. So this guy basically goes out there and tells everybody that they're terrible, horrible people for wearing a face mask. Now, as he's doing this piece, notice how close you are to his head, right? It becomes painfully obvious, if you've ever worn a face mask, that this tool is wearing it not only too high over exposing his chin, because that's supposed to be like covering your chin, right? But uh, this clearly poorly educated Worsted Caribbean Medical School graduate, uh, is wearing the mask upside down. He's wearing the mask upside down. See, the little metal band is here. I don't know if you can see. Whoop. That's the part that, you mold over your nose. Yeah, this should be down here. This should be up here. Molded over the nose. Yeah. Well, I gotta say, it's definitely not gonna protect anyone like that. You're absolutely right, Spiegel. Good job, bro. You get a tinfoil hat. Fucking tool. Okay, Jerome Adams, Surgeon General. So this guy is absolutely completely reasonable. The fact that he came over just right after the other two guys does not imply that I think this guy's a quack, because I don't think he is. I think he's a pretty thoughtful guy. The problem again is with the language. So, not too long ago, he posts this jewel, February 29th. Seriously, people, stop buying masks. So, the sentiment is, stop eating up the resources, right? Stop eating up the resources, because healthcare workers need them. I'm right on the money there. No problem. I'm behind you 100%. Here is the problem. Wah, 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 wah. They are not effective in preventing the general public from catching coronavirus. See, that's actually not true. It doesn't protect the wearer from getting coronavirus. It does sort of a marginal job at that. But it does capture lots of respiratory moisture and thus helps prevent the general public from having to catch coronavirus. So, by virtue of making an unelegant statement, he basically discouraged people from wearing masks. When what he could have said was, hey, don't buy a mask. You know what's really patriotic? Make your own out of a t-shirt, because you'll help prevent it and you'll keep those healthcare resources where they need to be. But he chose to say they are not effective in preventing the general public from catching. And he didn't just say it, he posted it as a tweet, which means, of course, people are going to circulate it, right? Because that's what you do with all tweets, especially from government officials who say questionable stuff or display outrage with all caps. So, you know what would be really, really appropriate as a punishment for someone who does something silly like this? I think an appropriate punishment would be having to demonstrate how to make your own face mask at home on the CDC's website. In a complete ironic moment, the guy who a month ago said, don't buy face masks, they don't work anyway, now has to go on the CDC's website and show the public how to wear a face mask and how to make one at home. And it's amazing. Just with a huge look of humble pie, he's like folding like a t-shirt into strips. It's just unbelievable watching, if you know what he said like a month ago. And listen, I don't want to make this guy sound like a hack, because I don't think he's like a quack doctor. I just think he used really inelegant language, which again has a price, and you have to be a little careful when you're tweeting in caps as a government agent. Like, you have to just be smart about what you put out there, and what he publicized just simply wasn't smart, and it was disproven later. So this fella, Raj Hirarchi, and I'm sure I'm mispronouncing that, so I'm sorry. He is the Deputy Minister of Health, not this guy, the guy I'm going to show you subsequently. So this is a quick video. But he has like this amazing moment, and this is about a month behind us probably in the outbreak. So this is Iran. They had lots of cases, especially right in the beginning, and I'm just going to cherry pick the segment of video that I want here. But it's kind of amazing. So he gets on TV, and he's talking about how we can beat this thing. We don't need quarantines. We don't need this. We don't need that. It's being a little flippant about the whole thing, certainly minimizing the extent of the problem. And I'll just let this, I think, New Zealand reporter do my job for me and here kind of narrate this thing.
And the death toll is 15. The outbreak is centered around the city of Qom, close to Tehran. And this man, the deputy health minister, became involved in a political row. Yesterday he said he'd resign if allegations that the government was hiding the true death toll in Qom were true.
Because
well,
Iran
now
never
he's
hides
become
stuff.
part of the story because he's got the virus and he was involved in the most extraordinary press conference. Here he is on the left, taking his glasses off, mopping his brow, looking decidedly unwell. He was telling those who had gathered that he doesn't believe in quarantine, that it's an old measure from World War I that doesn't work. The other man on the stage may have had a view on that. But anyway, here's what the minister is saying.
میخواستم به اطلاعتون برسونم که منم کرونایی شدم. من از دیروز تب داشتم، تست اولیه‌ام آخر شب مثبت شد. از دیشب خودم رو در محل ایزوله کردم. چند دقیقه پیش به من گفتن که تست
So anyway, he's on this public address telling everybody not to worry. They don't need quarantines. They don't work. We're gonna beat this thing all by itself. We've got this thing. As he's breaking out in cold sweats and mopping his brow, and he did another public appearance that evening. Same kind of thing, coughing into his like sleeve, just a hot mess. And next day he's like positive. So again, getting sick is not a sin. I mean, many of us are probably going to be sick, myself probably included. Nobody's immune to this thing. But when you minimize its scope and ability on television, and then the next day you come down sick yourself, that inspires like zero confidence in the people you're trying to motivate and calm. Again, government agents sometimes are so obsessed with keeping the public calm and reassured and not inciting panic that they just often make fools of themselves like this. And this is just terrible because you want to have some faith in these institutions. You can't just put out nonsense and expect your people to still trust you.
There are now over...
So that brings us to a couple of other folks in the column of doing a pretty good job. This Anthony Fauci from the National Institute of Allergy and Infectious Disease. So he has managed to become like the public's darling here. And what's interesting about it is he doesn't do it with pizzazz. He doesn't do it with showmanship. He's like a relatable guy with a Brooklyn accent who is a devout scientist, and he just tries to put the facts out there, and he does it in a simple way that people understand. And he has turned out to be the government's best mouthpiece on this thing. People will trust him, whereas they probably don't trust a lot of other people in the administration. And that goes for both sides of the aisle here. I mean, there's been a lot of really questionable statements made by a number of different parties. But generally speaking, when Fauci gets up, people are willing to listen, and they trust the information coming out of him. And what's fascinating about it is he didn't use any of the tools that we would ordinarily attribute to being successful with the American public, right? The posturing and like the kind of boisterous overconfidence and the fudging of the truth. Doesn't do any of that stuff. He gets up there, he puts out some stuff, again, in his New York accent, and it's believable and it's relatable, and I've never heard him horribly cover up facts so as to mislead people or to keep sheep calm. Every time he opens his mouth, the man has something decent to say. So good for him. Need a few more like that. So locally, our Commissioner of Health, kind of an interesting move that surprised, I think, a lot of people. She was at a press conference not too long ago, and she said exactly what you wouldn't expect. She said, "Hey, I'm definitely going to get it. You know what? We all are. I'm just kind of waiting for my turn." And so unlike the Deputy Prime Minister of Iran, or sorry, Health Minister of Iran, she basically said, "Yeah, I could totally get this thing. In fact, it's pretty likely. I'm almost definitely sure it's going to happen to me." And that really humanizes the illness to some degree, right? I mean, it makes you not a terrible, dirty person if you get sick, and it makes people sort of understand the idea that, hey, if this lady can get sick as a government health official, then I can get sick, and maybe I should take this thing kind of seriously, right? Maybe I should make sure that I socially distance and I wear a mask, and this is substantially more dangerous than maybe I thought it was 5 minutes ago. So yeah, good for her. Unexpected move. People often try to fill you with courage, but don't necessarily like humanize the thing or make themselves vulnerable. And I thought that was a fine display. Okay, so conclusions from today. Being straightforward and honest, I think, tends to save lives in the long run. I get that most politicians think the American public is this like fragile ceramic doll that needs to be handled with kids' gloves. And listen, I know we've had our moments. Trust me, like I get it. I mean, we're buying toilet paper and masks, but that is not a U.S. phenomena, by the way. That's happening everywhere. So I don't know that that's necessarily a U.S. problem. Being less than honest requires deprogramming later. I mean, the CDC thing is just a brilliant example of what I'm talking about, right? Masks don't work, and then a month later, oh hey, you should tear up your old T-shirts because you may need them to live. It's not a good way to put forth information during a pandemic. So honesty also prevents a lot of politicizing. So if you're worried about party politics, not being honest and then having your information proven wrong, just gives the opportunity for the other party to call you a liar and make you not seem honest, right? And for the people who care about that stuff, that definitely diminishes your position. So we'd probably have a lot less politicizing if we were just all honest about what's going on. And again, maybe I'm a naive sucker for thinking it, but I think the American public is able to tolerate hardship. That didn't go away in World War II. I think millennials and even Generation Z, I think those guys can and will tolerate some hardship. I think they, if asked to, I mean, let's face it, the American public has not really been asked to confront any huge, massive crisis in the last 20 or 30 years. I mean, we could say September 11th, and that's reasonably true, but that was a very short episodic thing, localized in New York with a few thousand casualties. I'm not diminishing its significance, I'm just saying it had a limited scope. This is far greater in its scope, and it's going to affect the whole world, not just our country. So I think at the end of the day, I have a little faith, just a little, but enough, that the American public can hunker down and like slog it out with this thing if asked to. So let's give them a little credit. That is my final thought for today. I have a shift tomorrow, and I should have been in bed an hour ago. But stay safe out there.